Hi, my name's Alicia Scarlett. I hope you're doing as tremendously as possible. I was told to do videos like this. This one's about Dr. Tracey Samko, and um, this was admittedly not as bad as other experiences I've had with providers since I saw gender affirming care in California. It was in LA, now I'm in San Jose. But she, it's still worth talking about. So, I saw Dr. Samko and started seeing her, I would say, in the late summer of 2023. And it went until the summer of 2024. Started off great. Her first report for me was amazing. Um, and so I was really encouraged. And I told her I was really encouraged. Said that in an email. But one time I told her in a message, that I was feeling suicidal. Now, the the webpage for the clinic where she worked, she doesn't work there anymore, and I want to say that her supervisor said that there was um, structural changes that needed to be made to the department, and she and the other doctor I saw there are gone now, are not in that department anymore. But Dr. Samko. So let me back one step further. I didn't like that I wasn't hearing from Dr. Gardner for a month in emails. She only worked there one day a week, but I think I should have been able to hear weekly from them, excuse me. Um, and so Dr. Samko was nice to take me after I complained, but um, she was really dismissive of me talking about me being suicidal. She claimed that the clinic can't provide that, but then the clinic does say they provide that. and so then I didn't appreciate that. So she calls me and she says, here's this resource, and I explained to her that I've called the resource before, and then she says, yeah, she explains why. But she knows that that's not really a good resource. And so made it a point in the next appointment to tell her that, so the clinic is for queer youth. That was their focus. So I went in and I was really concerned because, so with any type of healthcare, physical healthcare, I don't need to be a doctor to know that there's going to be sometimes overlap, or at minimum a bumping up of mental health to physical health. So I think it's reasonable that sometimes a mental health provider might hear about physical health problems, and if a primary care doctor does physical health, is going to sometimes hear about mental health problems. Especially if you see a doctor for a sustained period of time, there's going to be mentions eventually. I think that's very reasonable that that's going to happen. Well, when it comes to gender affirming care, there is overlap between physical and mental health. For instance, you treat what the US still calls gender dysphoria. Denmark doesn't, they haven't since 2017, but I digress. Gender dysphoria is treated in a physical way through like hormones, for instance, and surgeries. So it does overlap with physical and mental health. You're almost for sure going to hear. You do. What am I see? I'm not even realizing this till now. You do, because You're like, you get a letter from a surgeon. No, excuse me, not a surgeon, a therapist. You get a letter from a therapist saying that psychologically the person is, in my case, female, and then it goes to a doctor who does physical health and surgeons who do physical health in the case of gender diverse people. So I was blown away that she was so dismissive when for me and for any transgender or intersex or gender diverse person she's seen, there's automatically by default there's overlap. So I made it a point in this conversation to point out that there's going to be that for me, and to point out that she needs to. We're at a time politically in the United States where youth were under attack. This was, I mean, they still are, but at the time, this was like spring of 2023, 24, excuse me, and we were around the time of 24 or 25 states in the US banning gender affirming care for youth, banning essential care for kids. And so I pointed this out to her, and I said, you treat kids, you treat youth, and we know about the rate among gender nonconforming suicide rate and depression rates among gender nonconforming teenagers and youth. And here she is saying nothing about mental health, when again, I don't mean to repeat unnecessarily, but by default there's overlap with mental health and physical health in gender nonconforming people. So I was just pleading to her that she not be dismissive of the mental health of patients who are queer youth, and specifically gender nonconforming, and is what I was addressing. But they do, it's an LGBTQ youth clinic. So she cuts it off, and I call her robotic, which I don't apologize for. I do apologize and feel bad that I then called her R2D2. That is where I made a mistake. But it is so negligent for her to ignore mental health of queer youth when mental health overlaps with gender nonconforming youth, when mental health overlaps with physical health, when the clinic says they provide mental health services. And she has to well know that she's making referrals and prescribing hormones for a mental health condition, according to the US, gender dysphoria. So it's malpractice. That's how negligent it was of her. So yes, I call her R2D2, but she also is committing a malpractice. She also isn't at that clinic for what it's worth, nor is the doctor that I went, Dr. Gardner, who I left and then saw Dr. Samko. Same clinic, but they were doctors in the same clinic.